Well, welcome, and today we want to do a bit of a global update, just see what's going on in various parts of the world. Now, the World Health Organization have been commenting on this, as you might expect, and they're saying this, that the coronavirus outbreaks are not under control in most countries. Now, it's varying a lot from country to country. Cases do seem to be increasing in Africa at the moment, for example, while in Europe they seem mostly fairly well under control. Although with the release of lockdown measures in Europe at the moment, I am expecting some increases. I don't know how much increase, hopefully not too much, but it could be a significant increase. If you're in the United States, of course, you're only too aware that there's a great increase in cases, as there is in Central America and South America as well. So coronavirus outbreaks are not under control in most countries, according to the World Health Organization. And they also say the pandemic is still accelerating globally. So this is still increasing. We are still on the way up. We're still on the upward curve. Infections have doubled in the past 6 weeks globally. So the infections have doubled in the past 6 weeks, and there's some indications at the moment that that rate of acceleration is actually increasing on a global scale. And the World Health Organization again are clear that the pandemic has yet to reach its peak. We are nowhere near the peak yet. Most countries, only a few percent of people have been infected. Some places maybe 5-10%, some areas maybe 20%, but we need 60 or 70% before we establish herd immunity. So as a planet, we are still on the upward curve, unfortunately, of this pandemic. So that was from the World Health Organization. Now, we'll go on to the United States. I'll maybe look at a couple of graphics first, actually, from the United States. So this first one here, this is the number of new cases, daily new confirmed COVID-19 cases. And I've included the 3 worst affected countries here at the moment, the United States, Brazil and India, or the countries where things are accelerating most. Russia also has a lot of cases as well, of course. Now this is a linear scale, and of course the United States has got a large population, but nowhere near as large as India, of course. But we see the steep increase in India. Sorry, the steep increase in the United States. Certainly some increase in India, of course. Yeah, India is increasing. And because of the nature of the population and the living conditions in India, I do expect that to increase more dramatically. But we see this in the United States that's happening at the moment. And as we see, we're consistently on over 50,000 new cases per day at the moment. So that's the increase in cases in the United States. Now, what is moderately encouraging is this is a 7-day rolling average of deaths. So new daily confirmed deaths. And we see that in the United States this has gone down nicely. Now, these are artifacts due to reporting and the way things are classified, so they're not genuine. So what we see is that the deaths in the United States aren't, at least yet, following the upward trajectory of the cases. So what's going on here? It's a bit hard to say. Of course, it could just be the lag effect that, of course, when people get the illness, they tend to get sicker in the second and the third week. So there could be a lag effect, and death is often delayed by 3, 4 or even 5 weeks. So we are seeing a lag effect, but I'm also hopeful there's something else going on here. We've got now better social isolation, but as well as that, well, that's going to reduce the number of new cases, hopefully, although it's not working in the States at the moment. We understand it, it's just a matter of operationalising it that's the problem. We kind of know what to do, but it's not always being done. But treatments are getting better. So, for example, we know that dexamethasone now is efficacious. And other people are using other anti-inflammatory drugs as well that seem to be having a benefit, other steroidal drugs. But we know from trial data that dexamethasone is effective in reducing complications in patients that require oxygenation or ventilation. And as well as that, I think we're learning more about treatment and management generally. So there is some encouraging signs there, but we're not out of the woods yet by any means. And there is no doubt in my mind, really. There is no realistic doubt, I'm afraid, that there will be an increase in deaths in all of these countries, just with this lag effect. So we have got difficult times ahead. There's no question about that. Now, that is reflected by Anthony Fauci. They're the cases in the US there. As we know, we're familiar with those. Now, Anthony Fauci said, spectacularly transmissible virus. I must say, for a scientist who's sort of seems to be involved in politics as well, he does use fairly straightforward language. Everyone can understand this. Spectacularly transmissible virus. This virus is spreading rapidly. Public health officer's worst nightmare. So he's pretty frank about that. Now, what I've been doing as well, just as another sort of way of seeing this, is for the past week or two, I've been collecting these. Let's get rid of me a minute. I've been collecting these figures here. So these are the dates and the number of new cases in the United States. So this number here is just the number of new cases. So we see on Thursday, the 9th of July, a peak number of new cases, 65,000, more than 65,000 new cases. Now, these numbers here do vary somewhat. The American Centre for Disease Control and Johns Hopkins do seem to have varying figures, but this is certainly the range. But there's no question that we are unfortunately seeing increases in numbers here as time goes on. And this is going to increase. Next week, we will be seeing new numbers well in excess of that. There's no way around that at the moment, I don't think. So it's just a matter of time, I think, till we're seeing 100,000 new cases a day in the United States, because we have accelerating community transmission. Now, just to give some examples, particular states. Texas. In fact, cases are increasing in many states. I won't look at it this morning, but we've looked at it many times, where we've looked at this RT in real time, and in nearly all states, numbers of cases are increasing. The reproductive value is increasing in virtually all states, about 42 states at the moment, I think. So this is Texas, for example. So 24 hours, another 105 deaths, taking the total up to over 3,000. In Texas, nearly 10,000. In fact, by the time you read this, it probably will be 10,000 people hospitalised. And of course, the health provision is greatly struggling. Elective surgeries have been postponed pretty well everywhere in Texas. And of course, this has got troubles of its own. People can die from other things as well as COVID-19. So again, we see this collateral effect that we've bemoaned many times on this channel. Greg Abbot, Governor Texas, virus spreading rapidly across the state. This is what Greg Abbott is saying. Next week, the numbers will be worse. So he is fully accepting of the fact that this is accelerating. And there's a statewide mask order to prevent renewed shutdown. And I think most people are complying with that. If you're in Texas, do tell me, but it does seem most people are now complying with this. Better late than never, but wearing a mask is much easier and much cheaper than not being allowed to go to work for 6 weeks. California, just for another example, increasing number of deaths, not dramatically increasing numbers of deaths, but the accumulative number is going up, of course. And what is concerning here in California and Florida is a third of tests are positive, so well over 30% of the people. So a lot of people are reporting for testing. And those people that are tested, about a third, over 30% are testing positive. This means there's an awful lot of viral spread in the community at the moment. This is why I am certain there's going to be a dramatic increase in cases over the next few weeks, because so much of the virus is prevalent in the community, A third of people reporting for testing are positive in California. The next few weeks is going to be difficult. Florida, again, the number of deaths in 24 hours. And this number just keeps on increasing, of course. A third of deaths in Miami are under the age of 60. This is another worrying trend. A third of the deaths in Miami are under the age of 60. Much higher than we've seen in other places. Now what is going on here? Now, this is partly related to comorbidities, of course. It's partly related to age and ethnicity, but we've seen these cases are a third of the cases are under the age of 60. So what's happening? Well, what I think is happening is that people are not respecting social distancing properly, coming into contact with people who are infected and receiving a high infective dose. So if you get 10 or 20 viral particles and you're exposed to a small number of viral particles, they might just go in the upper airway and you can start generating immunity while you've just got mild upper airway disease. So the generation of antibodies will start and you'll get some protection. So by the time the virus works its way down to the lungs, hopefully you've got some antibody cover, some immunoglobulin cover to fight the disease down in the lungs. Now, of course, quite why some people develop the acute respiratory distress syndrome due to the inflammatory reaction is somewhat of a different line of thinking. But if someone's exposed to the virus, so young people, for example, taking risks, and they're exposed to hundreds or thousands of viral particles at the same time, as you easily could be in a fairly close social situation, then the viruses aren't going to be filtered out by the upper airway. They're going to go straight down to the lungs. And then they can start causing infection right down at the level of the alveoli. And the pneumonia can present earlier. I think that may be why young people are getting more. There's more cases of young people and indeed tragically deaths in younger people under the age of 60. And generally in the United States, this is the trend that's being reported, younger people being hospitalised. Just one more state as an example, Arizona. Now in Arizona and with other states, 12,000 tests are being conducted every day in Arizona. And to be quite honest, that's a drop in the bucket. It's nothing like enough. And some people apparently are waiting up to a week for the results. And of course, many of these, in fact 34% of the people that are tested, are coming back positive. So there's a backlog in these tests getting actually performed once they get to the lab. And as we see here, 34% of them are positive. Now this means two things. Firstly, it means the virus is very prevalent in the community and there's a lot of community spread. But it also means combining that with the 1 week delay, it means that of the people that are positive, 34% of them go on spreading the virus for up to a week because they don't know they've got it. This is why it is so important if someone is symptomatic. So really, if someone's concerned enough to go and get the antigen test, if they're concerned enough to get the test, then really they should self-isolate for 14 days or until they get a negative result. But unfortunately, at the moment in Arizona, 34% are getting a positive result. This is a significant amount. And this means that the spread is out of control, is basically what it means. So for the next few weeks in the southern states and the western states, we are going to see exponential growth. The rate of growth is the rate of acceleration is accelerating, and as more cases come along, the rate of increase is going to accelerate. Unfortunately, still need to mitigate it and slow it down as much as possible because health services in these states that I mentioned here are getting very near capacity, especially critical care capacity is now over 90% in most of these states, and that means that case fatality rate has got the potential to increase quite dramatically if appropriate treatment is not available. Now, coming on to the UK, deaths are increasing. Face coverings mandated in shops in Scotland. So I thought that was good. In England, you don't have to wear face masks or face covering rather in shops. Now, and my COVID symptom tracker app tells me that there was 1,471 new cases. The official figures from the Office for National Statistics are less than that. But this is probably accurate because this is collecting data from about 3 million people. So, now we've mentioned a few times the way that this virus is casting light on things that are often ignored. And there's one example of this. Now, and I must say, I was guilty of ignorance here as well. I didn't realise it was as bad as this because there's been 16 deaths up to the 26th of June, 16 deaths in homeless people. And the average age of deaths was 58 years. So relatively young. But what I didn't know, and it really is quite a sad reflection, deaths of men who were homeless in 2018, the average age of death was 45 years. So that really is a bit of an indictment on any society that people with these difficulties, such as homelessness, that their average age of death is 45 years. Now, I know it's tied up with other things. There's alcoholism, there's drug abuse, there's mental illness, there's physical illness. There's all sorts of things go with it, but nevertheless, that is a young average age of death. So the people dying of COVID-related disease, average 58 years in homeless people, is actually higher than the average death of homeless people generally, at least according to the 2018 data. Now, Australia. Only citizens and permanent residents allowed to re-enter. Basically, the country's closed down like New Zealand. 14 days quarantine in hotel, paid for by state government, has been the case so far. From Monday, only 4,000 people are going to be allowed in each week, probably about half of what they were, and they've got to pay for that themselves. Now, that means that anyone going into Australia has to pay for themselves to stay in a quarantine hotel for 2 weeks. And you're looking at a very substantial amount of money there. So what this really means is poorer people probably won't be able to afford to fly back to Australia, because you're probably looking at, I don't know what you're looking at for a hotel and food and everything in Australia for 2 weeks, $2,000 or $3,000. It's a problem. Melbourne, Victoria, as you know, 5 million people locked down for 6 weeks. Now, fortunately, the number of people hospitalised in Melbourne is still relatively low. It's 46 people hospitalised in Melbourne at the moment. And this is from the Australian dashboard today. So we saw the increase in cases, nicely flattened off. And these cases here, this dramatic increase, are mostly cases in Melbourne. Mostly in Melbourne, which of course is shut off from, now completely shut off from New South Wales. And I think the border between Melbourne and New South Wales was last closed off in the 1918-1919 flu pandemic. So, yeah, it's been over 100 years since that border's closed, but now it is. Now, I've included Kazakhstan today because there's a bit of... This is concerning. Now, we know the pandemic is progressing in Kazakhstan, the COVID-19. But, now this is the Forbes reference, but do look at it for yourself. But it's all referenced in all the major news outlets. An outbreak of novel pneumonia in Kazakhstan. So it seems to be that there's a new form of pneumonia in Kazakhstan. Now, the alarm bell here was first rung by the Chinese embassy, who say there's been a significant increase in a new type of pneumonia. This is not a COVID-19 type of pneumonia. And they say it's got a much higher case fatality rate than COVID-19. Don't know what it is, but basically a lot of people that get it are dying. And the deaths from this new form of pneumonia are estimated to be 1,772. And in June, the cases have accelerated. 628 of those cases occurred in June. And the Chinese are reporting that this is a new viral pneumonia that is not COVID-19. but with a higher case fatality rate, so it's more lethal than COVID-19. Now, I haven't been able to find out what this pneumonia is. It does seem to be a virus. All the news reports are saying it's a new form of virus. And if that's the case, if we've got a new form of virus, is it a mutated form of COVID-19 that is more virulent, that is killing more people that it infects? I think that's unlikely, because the COVID-19 is a slow mutating virus. Yet it seems to be there. Now, having said that, the Chinese are quite clear about it, that this is happening. The Kazakhstan authorities deny it. They say that it doesn't exist. So, more to come on that. But the potential, I wouldn't say I'm worried at the moment, but the potential to be worried is there. If there's a new viral pneumonia, you see, when people have one type of chest infection, they are more prone to getting another type of chest infection. And we've talked about this repeatedly, that people get secondary bacterial infections, for example. Could it be that when people are exposed to COVID-19, that's weakening the local immunity in the lungs and predisposing them to this other viral pneumonia? We actually don't know. So the Chinese are definitely saying it's there. The Kazakhs are definitely saying it's not there. But given that the Chinese seem to have figures for the number of people dying from this new form of pneumonia, it is concerning. Now, Russia is also an epicenter. And again, the number of deaths in Russia appear to be very low compared to the number of cases. And of course, the real number of cases in Russia is high because they're only the diagnosed cases. And we know that the health facilities in Russia were optimized, I believe was the term that they used a few years ago, meaning that they weren't optimized. Now, moving on to South America. Mexico is badly hit. Now, there's been a poor government response in Mexico. So these nice, kind drug cartels, you know, these nice people that work in drug cartels, they're giving food away to the poor. They're filling trucks with food, and they're giving it away to poor people in the slums and poor people in the villages, and isn't that kind and wonderful of them? So the drug cartels are trying to fill the void left by the deficiencies in the government. And I've seen the videos of this. They're giving away very generous, large amounts of food to poor villagers. And of course, the hungry villagers are accepting it. You know, if I was hungry and a drug dealer gave me food, I would eat it because I'm hungry. You know, if you've ever been, most of us haven't been that hungry. I've only gone without food for a couple of days. But at the end of that, you're really, really hungry. So, distributing food to poorer areas and villages. Now, these nice people, these nice drug cartels, have brought about an opioid crisis in Mexico, which is really bad. These poor people don't need opium addiction. It's not opium, it's morphine, and it's fentanyl, actually. But there's a huge amount of it in Mexico at the moment. Apparently, there's massively increasing amounts of guns, which, of course, accelerates any form of violence. The drug cartels are responsible for 250,000 deaths in Mexico. That is this is like wartime levels. 250,000 people have been killed, murdered in Mexico since 2006. Now, quite a lot of these have been caught in the crossfire, but it doesn't alter the fact they've been killed as a result of the drug cartel activity in Mexico. And since the lockdown's been instigated, there's been 300, killings is the wrong word, murders. There's been 3,000 murders a month as drug cartels seek to maintain their power. But it's good that they're giving food to poorer people, but a sad indictment that the government has not been doing that. And of course, this is a clear, cynical, manipulative device by these cartels. So, again, one of these sort of collateral effects, you know, one of these effects that you might not think about, but is still a very real problem caused by the pandemic. The drug cartels consolidating their position in Mexico. Now, Brazil greatly increasing cases. Huge amounts of graves being dug in Brazil. You've probably seen the videos of that. Especially in the indigenous areas, the death rates are high. The deaths are massively underreported in the indigenous areas. They're simply not being recorded. So, huge toll in Brazil, particularly high toll in indigenous areas, which of course is tragic, as if these indigenous peoples haven't suffered enough. India, as we've said, accelerating. This number is bound to be a great underestimate in India, of course. More to come on India. Unfortunately, in the next few days, we are going to get exponential growth in India, and a lot more people are going to get the infection, and many more are going to die in India. Hong Kong. Now, Hong Kong had done so well at the start, but now all schools are suspended. Not a massive number of new cases, 42 in the 24 hours, but 34 of those were community transmission, meaning that viruses is kind of out there. Now, I've got more to do on things from the World Health Organization, but I think I'll leave that there for now, and we'll load that as a separate video. So thank you for watching this one.